It is going inside the, who is this? Epididymis, right? It is going inside the epididymis. Then what happened? Then they finally will form one tube. And this tube will make a coil. See how they are attached. So this coiling in the epididymis, they said it is 6 meter in length. 6 meter, roughly 18 feet. If you uncoil this duct or tubes, it is just like a spring, and if you straight the spring into a straight, then they found that this length of this pulse difference would be 18 feet. 6 meter means 18 feet. How it is impact. So it contains or it stores the sperm, and these sperms are matured sperms. Okay, so now question, where are the epididymis connected with the testis? Posterolateral. How many parts are there for the epididymis? 3. Head, body and tail. Which part is above the upper pole of the testis? Head. And the body is in the middle part and the tail is the narrower part. Okay, and it looks like a comma shaped.
Does the efferent tubules only connect in the body or?
Yes, it goes, that is, you can say this is a hilum, just like a kidney, this is a hilum through which
goes right into the body of them.
So now, sometimes there's a appendix testis. This is a fetal remnant, is non-pathogenic. We call it appendix testis. Appendix testis. Sometimes there is a little same thing on the epididymis. We call it appendix epididymis. Appendix epididymis. Is it pathologic? No. Can we see? Normally we don't. Then when we can see? We can see when the background is dark. How the background could be dark? It's only possible when there's a fluid collection. That's why when there will be a fluid collection, then background will be dark. I'm just drawing for you a little. If the background is dark, anechoic, now we can see appendix epididymis, appendix testis. You can easily see it. Okay, so you got it. Sometimes they will give you this diagram and they will point out, they will ask you, what is this? Okay, so this is epididymis, And epididymis, most of the time you will see the head is seen with the testis, and if there is an infection, local focal infection, it is in the head. When there is a diffuse infection, then we can see the body and tail. Otherwise body and tail we cannot see. And when there is a diffuse, then head, body, tail all are visible and highly vascular. We'll talk. So now one more thing here, we got the six layers of the scrotal wall, and one thing just understand here, okay, on both sides this is known as spermatic cord. Can we see the spermatic cord? Say yes. Yes, sonographically we can see the spermatic cord. What are the content of the spermatic cord? Just common sense. This is the cord through which the vas deferens goes up. Vas deferens goes through the inguinal canal, then it goes into the pelvic cavity, makes a loop by the lateral wall of the bladder. Spermatic cord contains the vas deferens. Look, this is the vas deferens. Then what else? It contains three sets of arteries. One for the testicular artery, one for the epididymis artery, one for the cremasteric artery. It contains the pampaniform plexus of vein that returns the blood. It contains the nerves, lymphatics, fat, and the fossa that makes the bundle. So that goes up. That is spermatic cord. Why do I need to know this? If I draw a diagram, then you will say, oh my God, the boy is in danger. Yes, the boys are in danger. Why? Because, so this is the testis, right? This is epididymis. This testis and epididymis is hanging inside the, look at here. It is hanging inside the scrotum. With whom? It is hanging by spermatic cord. It is hanged by the spermatic cord. And so this is spermatic cord. The whole thing is a spermatic cord. If this spermatic cord gets twisted, normally it's not going to happen. Why? Because the testis is attached with the wall of the scrotal sac. Posteriorly, it is attached with the wall. So that testis is not easy to rotate. If it is partially rotated, then it will be unrotated. So make it easy. Because gymnastics, sports, playing, upside downwards, and manipulation, and the kids to 10 years, 12 years, they play with that, right? they rotate. And if it is not untwisted, it would be torsioned. And this is normally does not get torsion because it is attached with the wall, so it does not get a complete torsion. But if this attachment is absent, that is called Bell-Clapper sign. In this type of case, the testis and epididymis is not attached with the wall of the scrotum. As a result, it can twist in either directions. Complete twist, it may not get back untwist. So when it is twist, then what happened? It will be twisted like that. If this is twisted, means what? All veins will be collapsed. Then all artery will be collapsed. The nerve will be tight. And lymphatics will be tight. As a result, all back up. The scrotum will be swollen. Testes will be swollen. And there will be lack of blood supply inside the testicles because no supply is coming. But around the testis there will be supply because that are coming from the collateral, but it does not go into the testis. And the testis will be enlarged, edematous, hypoechoic, no vascularity, no function of the cells, and it starts dying, necrosis, hypoechoic, and if it is not saved by 6 to 8 hours, by 12 hours the testis will be dead. It has to be taken out. Okay? So that's why we need to know the spermatic cord. Spermatic cord can be twisted. That means your testis and epididymis will be twisted too. That is a danger, acute situation. Okay. So we came into the normal shape. We understood the anatomy now. So now I will discuss about the lab values. If there is a pain in the testis and the fever, we want to do the WBC count. WBC count can go up, indicates what? Infection. Right? So then another lab test can be beta HCG. They do this beta HCG test. Why? There is a choriocarcinoma. Choriocarcinoma of the testis. In this choriocarcinoma of the testis, beta HCG will go up. Beta HCG. Then they do the alpha fetoprotein, AFP. Alpha fetoprotein is increased with cancer to the testis, embryonal carcinoma, then teratoma. Okay? It goes up with embryonal carcinoma, then teratoma. Okay, so and urine analysis. Okay, and urine analysis. So that's it. And what are the other, okay, indication? Okay, let's talk about the indication. Why? What going to happen? Or why a patient will come to the doctor and the doctor will write down for a ultrasonography of the scrotum? Why? Number one, what are the indication?
Pain.
Pain, palpable mass, history of trauma, history of infertility, what else? Scrotal swelling, missing of testes, missing of testes in the scrotum. Okay, normally these are the things. Then what are the other modalities for the scrotal evaluation? What are the other modalities? Means what are the other things? Keep that in mind. It is testis. Scrotum means testis. Make sure I don't want to use the radiation. Right? So now physical examination. After physical examination, then the doctor will order the ultrasonography. Ultrasonography. Ultrasonography we do with Doppler. Most of the time, so 95% time, ultrasonography with the Doppler can give you the answer. What is the pathology? Even the testis is torsion. With the Doppler, and this Doppler, keep that in mind, we will use the power Doppler. We call it angio. Why? Because the power Doppler or angio will detect the very slow flow. Even through the capillaries there is a flow, and it is angle independent. So if there is a little change of pressure due to the flow presence, it will be colorful. Then you have to understand, it has a time, it is savable. Testis could be saved. Okay, so now some places they will do this plus nuclear medicine. Nuclear medicine means functional test. They will use the radioisotope. They will use the radioisotope this radioisotope will be taken by testicular cells when the cells are alive. So now if the cells are alive, so I'm just drawing the cells. So these are the cells, and when the cells are alive, they will uptake the radioisotope, and these are the radioisotope. If you see the radioisotope, when they will take the picture, if you see the radioisotopes are found or present inside the testicular cells, that means what? The cells are alive. That means, yes, let's go take the patient into the operation room. We'll open, we'll untwist. Organ could be savable. Same thing for the torsion of the ovary. Ovary can have the torsion, and we can save the ovary too, because it's a very time sensitive issues. Okay, so other modalities we done. Now normal sono appearance of the testis and epididymis. We need to learn the normal sono appearance. So let me so this is a rectangular shaped image, and this image is created by which type of transducer? Linear sequential transducer, high frequency. Okay, that I'm going to give details when I'm going to talk with the protocol technique. So now the first couple of millimeter, this is the skin thickness. This is the skin. So this skin thickness, if you measure from here to there, it should be less than 5 millimeter. Okay, so now this is testis. Testis has its own dimension, means measurement, length, height and width. Usually the length, say 4.5 centimeter, the height 2 to 3 centimeter, and the width 3 to 4 centimeter. Okay, so now you will see the testis is very close to the skin, and it has a very strong reflection called a specular reflection.